We have an exciting work plan for next year of things coming up. The most exciting thing, of course, is the registration for the international conference in Chicago will open on February 1st. So I don't know about you, that seems like a long ways away to me, but it is literally right around the corner. So, keep an eye out for that, start thinking about it, bug your bosses, make sure it's in the budget, all of those things. Our hope is to have 3 in-person events like we did pre-pandemic, so cross your fingers. The registration for the Future of Commuting Summit should open in January, I believe, right before the international conference. That's going to be in Pittsburgh at the end of April. So those are kind of the biggest things that are going on. I just want to thank you all for being here. Thank the Patriot chapter for putting this on, and looking forward to hearing from everyone.
Great, thanks, Elizabeth. So without further ado, we'll get started. We have 3 great speakers for you all today who all implement microtransit across New England in really different and interesting ways. So we're going to get an opportunity to hear a little bit about some of the things they're proud of and some of the successes of their programs. I'm going to do all 3 intros right now, turn it over to them, and then we'll have some time for questions at the end. I think generally if folks are able to raise their hand and ask questions over video, that's great, but I'll also monitor the chat. So if questions come in that way, we'll try to get them all in as well. I know we only have an hour, so try to get through everything. So we are going to kick off. Our first speaker today is going to be David Kucharsky from the city of Salem. David is a transportation planner with over 20 years of experience working in the public, private, and nonprofit sectors. Mr. Kucharsky is originally from New York City, where he spent several years working for private engineering and planning firms, as well as the New York City Department for City Planning. He relocated with his wife and 2 children to Massachusetts in 2010. He is currently the Director of Traffic and Parking for the City of Salem, responsible for overseeing the city's transportation policies and programs, as well as planning, implementation, and development. Prior to that, he worked as town planner for the town of Lexington and was the executive director for Mass Commute. After David, we will be hearing from Terrence McPherson from VIA. Terrence helps cities and transit agencies define their goals and priorities for improving mobility. Part consultant, part project manager, and part salesman, Terrence acts as a conduit between transit agencies and the many operational teams involved in scoping and delivering every partnership. Prior to VIA, Terrence was an engagement manager at Deloitte Consulting, where he led projects for Fortune 500 companies and early stage startups. He helped clients to define their sales and service strategies and led cross-functional teams to operationalize their most critical initiatives. He holds an MBA from the University of California at Berkeley and a bachelor's in business administration from the University of North Carolina at Chapel Hill. And last but certainly not least, today we'll hear from Angela Constantino from GATRA. Angela Constantino is currently the mobility manager at the Greater Attleboro Taunton Regional Transit Authority, GATRA, in Taunton, Massachusetts. Prior to GATRA, she worked at the Southeastern Regional Planning and Economic Development District for 10 years as a senior transportation planner / mobility manager. Her focus is on mobility management, graphic design, and operations planning. So I am going to share my screen here, and David, let you take it away. Is that coming up okay for everyone?
Good afternoon, everyone. Thank you for the opportunity to talk about the Salem Skipper. Today's actually our 1-year anniversary. We actually launched this time last year, and here are some photos we took with the mayor and Representative Tucker, and we had Mrs. Claus, an elf, and a Grinch help us to get the word out locally about this service. I have a few slides to go over with you with some background, how the service has gone since launching, and then talking about how we've been engaging with the community who's using the service, as well as building relationships with stakeholders to get some partnerships going for the service. Next slide. So we'll start with background and service review. In 2017, city staff worked with Salem for All Ages, which is our local ages community initiative. We got a grant from Tufts Health Plan to look at whether having an intracity shuttle and the city was even feasible. That study was completed in 2018. It mainly looked at fixed route services, showing that it could work. When I came on board, Mayor asked if we could take a deeper dive, work off of some of the preliminary findings to do more of a market analysis and service assessment for the city. We hired a consultant, Nelson Nygaard. This is one of the maps that they put together for us, looking at the city's transit propensity, what's the likelihood for people to use it, the demand, looking at demographics and land use, what are the major trip generators, as well as what services besides a fixed route could be introduced in the city, and having an on-demand rideshare service was one of those options. We obviously proceeded with that. We did a procurement process, and VIA was selected in February of 2020, and to provide what we call a turnkey service. So they're essentially providing us with the vehicles, the drivers, the software, which acts as a virtual dispatcher, as well as the customer service provided when the service is in place, as well as helping us with developing the marketing, the wraps for the vehicles, and other materials that we use when we launched the service. We awarded this in February of 2020, and then we all know what happened next. So we spent the better part of the year figuring out how to launch a service that we were trying to promote, which would be shared in the midst of the pandemic, and looking at protocols to make sure that it's safe for people to drive and ride in. And we again we started working with them in October, working on the marketing aspects of it, and how we were going to get the word out, what it would look like, the wraps for the vehicles and all those details. Next slide. And as I said, we launched a year ago today. The service started Monday through Fridays from 7 to 7, with Saturday service from 10 to 6. We had 5 vehicles, one of them, which you could see, this is the Pacifica, as well as 2 Dodge Caravans, which were wheelchair accessible vehicles. All the drivers were trained and how to operate those vehicles. The fares are $2 each, but reduced for senior citizens, students, and people who indicate on their profiles that they need door-to-door service, have accessibility needs. The initial round of funding came from a MassDOT workforce grant, as well as community benefits agreements, where the city negotiated with larger developments like the footprint power plant to get some money to be used towards transportation efforts, as well as a transportation enhancement fund that the city developed for a lot of the permitting projects. When we have site plan review, there's decisions by the planning board where a certain amount of money goes into this fund, as well as the marijuana dispensaries that we have in the city. Based on the success of the service, and which I'll get to in a couple of slides, we expanded that service on October 1st, just in time for Halloween here, providing service to midnight, Monday through Thursday, with 1 a.m. service on Friday and Saturday, and introducing Sunday service, which we were hearing from residents from the very beginning wanted to see. For those evening services, the fares were increased $3. We added an additional vehicle. And again, the funding was from Community Benefits Agreement, Enhancement Fund. And in this round, we have a partnership with Salem University, who are contributing towards the actual cost of providing the service itself. Next slide. So here's the performance that we've seen for the year. Just on the left side is our preliminary goals. Given the uncertainty of launching a service like this, our utilization rates that we were looking at was about 2.5. And this essentially means the number of rides completed per vehicle per hour. We were anticipating maybe 71 completed trips a day and about 425 trips in a week. After I'd say about the first month, we were exceeding that right off the bat, which we were certainly glad to see, and we were getting positive feedback across the board. To date, we're a little over 34,000 rides completed, with a peak of little over 1,300 in a week and close to 250 peak rides a day. The average wait times are close to 15 minutes with an 89% on-time percentage. We have about 2,200 unique riders, which are riders who've taken at least one trip, and several have taken more than 5. So we do have repeat customers, which is what we wanted to see. And the percentage of shared rides is almost 42%, which is for us the main driving force. And that's either someone is booking a trip with a +1 or 2 person in addition to the vehicle, or someone who's on their way to a destination where the dispatching software is picking up other people, which is the whole point of the service. In terms of the impact on the environment, based on the calculations that B has provided, we've saved over 18,000 miles and saved a little over 16,000 pounds of carbon dioxide. So again, having these numbers, we definitely were looking to expand that service. Next slide. These are just some key performance indicators with that expanded service over the last 3 months. Again, we're well exceeding sometimes we're having issues meeting the demand, I'd say that. So we're averaging 2,000 rides a week now with close to 370 average unique riders a week. We have a higher rides per vehicle hour, and the ETAs have increased slightly to ranging between 16 to 20 minutes, depending on the time of day. Next slide. Again, the robust ridership that we've seen, this is basically throughout the service launch from January of earlier this year, has exceeded our initial targets. I'll note that you'll see in June, we did have a drop. As the economy was opening up, we were dealing with the fact that drivers could make more money being Uber, Lyft drivers in the Boston area. So we worked with VIA on retaining and attracting more drivers to the service. We rebounded, and you can see that with the expansion, the riderships only increased with those weekend and evening expansion hours. Next slide. This is just to give you a sense of the origins and destinations in the community and pointing out a few of those sort of top 10 locations. The downtown is where our commuter rail station is, as well as the ferry, which is seasonal. A lot of our retail and tourism, obviously downtown. The Point neighborhood, which I'll get to in a moment, is near the downtown area. And Hawthorne Square is a major retail area where Market Basket, Home Depot, Target. So it's attracting a lot of people to use these services. And SSU is the university, and Salem Hospital as well. Next slide. Our highest ridership we're seeing is coming from one of our lowest income communities in the Point neighborhood. Approximately 42% of this neighborhood is living below the poverty line, and over 24% don't own a vehicle. We've seen about 9,900 pickup or drop-offs from this area. In addition, Pequot Highlands is another low to moderate income area in southern Salem, where we're seeing, again, high ridership. And from what we've surveyed, and I'll get into that a little bit more, 70% listed affordability as the top reason, and 85% of those riders said they didn't have their own vehicle. So again, one of our reasons for launching this type of service was to help users such as this to get to and from work, to and from essential trips, and in an effort to further notify people about the service, we worked with VIA to get a Spanish version of the app. And that's a misprint, apologies, that should say March 2021. So that further, I think, got the word out and made it more user-friendly for these communities to use the service. Next slide. So just a little bit more about the community engagement and partnerships. We worked with VIA back in July to put out a survey through the app We got a little over 100 riders to provide their input, looking at demographics, the usage, and overall satisfaction. 56% have incomes less than 50,000. So again, it's just showing that this is a very attractive service for individuals who need to get around the city. It's affordable and it's reliable. Those were none of the, in terms of the satisfaction, that's what we were hearing, that the reliability of the service and the affordability of it. You can go to the next slide. These are just some quotes that came from that survey. And again, the most common suggestions from the users were extending the hours, extending the service zone as well to go beyond the limits of the city, and improving the ETAs, which we believe was contributed to the fact that we were having some issues with driver partners in the previous month. Next slide. We were also seeing that this service is being heavily used by seniors in the community. And these are just some quotes. I won't read them, but this helps us to improve the service, to get customer feedback. And we do this throughout working with VIA to really help us make the service overall improve. Next slide. Oop. I thought there was one more, but in terms of, that's okay. In terms of partnerships, we've been having ongoing discussions with three main stakeholders. We've been working with the public schools, particularly the middle school and the high school. We've been working to provide vouchers to the students, not only to get to and from the schools, but for a lot of after-school programs, internship programs, especially that the high school students are using. So we found it very helpful for them, and we're continuing how we can expand upon that moving forward. In terms of working with the Salem Hospital, oh, here it is. Thank you. We're going to be launching.
I might have just stuck it in the middle there. Sorry.
Okay. We're going to be launching next month a custom booking platform for the hospital. In our discussions with them, they're finding challenges for patients who don't have options when they're discharged to get home after they've been in the hospital. So we're going to be launching this service to them, working with VIA, which captures some of the actual costs of providing the service and not just paying the fares. And the largest contributor I mentioned earlier is the university. Again, they are contributing to the overall service. This allowed us to expand into the evening hours, and this affords them the opportunity to provide a certain amount of free trips to their students as part of their contribution. So for us now, it's building on these partnerships with these stakeholders, and we're even exploring grant opportunities with the hospital and other medical providers to expand it more regionally. With that, I'll stop and happy to answer questions. I'm not sure we're going to go through all of them and jump back. Is that?
Yeah, thanks, David. Let's move on just so that we can make sure all of the speakers get the chance to speak, and then we will come back and answer questions for the whole group. So Terrence, if you're ready, I will turn it over to you.
Yeah, that'd be great. Thank you very much. And hopefully everyone can hear me. My name is Terrence McPherson, and I lead partnerships for VIA, which thank you very much, David, for providing an overview of the partnership that we have there. And you actually also took care of one of my slides that I was going to show, so that also saves some time. So I really appreciate that. We can go to the next slide. What I would like to cover today, I also have one of my colleagues, Josh Parnter, is here on the call. Just do a quick round of introductions, which I just did. Answer a couple questions about what is microtransit as a concept. I think you definitely would have gotten a lot of that context from David's presentation, but want to provide a little bit more of an overview. Talk about VIA as a company and some of the other partnerships that we have, and then experiences from the field, showing some of the metrics and key takeaways from the work that we've done with other transit agencies in the Northeast. All right, next slide. So what is microtransit? Oftentimes this might get confused with micromobility. They're slightly different concepts, but the idea behind it, microtransit, is a very efficient and accessible demand response option, which may almost look like a traditional dial-a-ride service that a lot of rural agencies or paratransit operations run, but think of it more as a mix of public transit with some of the more sophisticated ride-sharing technologies that you all are used to. How it works is we are able to take passengers who live in a similar geographic area or who are heading along a shared path, and they request a ride either through a smartphone application, through a website, or by calling into a call center. From there, we are able to dispatch an appropriate vehicle to pick them up, whether that is a traditional, say, 40-foot bus, a Sprinter van, a wheelchair accessible shuttle of some sort. And what it does is it picks up and drops off passengers with the actual demand that's happening in the community, and it dynamically generates routes in order to find the most efficient path to and from passengers. One of the benefits behind this is not only the convenience of reaching people where they are, we can actually get to where they want to be picked up and drop them where they want to be dropped off. It also helps to avoid the challenges of running a lot of deadhead miles. I talk to a lot of partners who comment that the citizens in their area are very sensitive to buses running with no one in them. And one of the benefits of a microtransit experience is that the vehicles only run when there's a trip being requested, but you can still have those shared benefits to really decrease that cost per passenger. Next slide. The philosophy behind this technology is that it's really convenience that drives demand, really makes people want to take it if they don't have to walk more than a quarter of a mile. Sometimes people have to walk miles to get to the nearest bus stop. So if you can bring the stops closer to them, then they will opt into the service, as well as driving efficiency. We have a case study. I won't speak about it too much in this call, but this is in Hall County, Georgia. We actually identified 3 underperforming fixed routes, which were mostly defined based on ridership and the headweights between vehicles. And we replaced them with an on-demand service. And then some of the great statistics we got just by operating that for a few months, we were able to decrease those costs per trip by about half since we weren't running those deadhead routes. The wait times went down by 4 times. So people were waiting a lot less for their vehicles. And the trips per week went up by 20%. Quick note on that. That is an increase of 20% compared to both the fixed routes that we replaced and the dial-a-ride service that the county was operating. So, that ability to request rides, to have it convenient, really unlocked a lot of transit demand, and now people are using it countywide. Next slide. So now that you have a little bit of understanding about microtransit and some of the benefits that it provides, I wanted to talk about VIA as a company. VIA is a transportation technology and operations company. And what we focus on is being the digital backbone of anything that moves in your community. So that might consist of fixed route transportation, which we do have solutions to still support that, on-demand microtransit solutions, ADA paratransit, sometimes non-ADA paratransit services, non-emergency medical transportation. We even have solutions for school buses and doing logistics and delivery. Our goal is to find ways to really optimize the use of all of your transit resources, or to help you secure additional transit resources to really expand your coverage areas, improve the quality of service, and do it for less per passenger. If you guys know Remix, we're actually one company as well. And so happy to answer any questions about how the Remix and VIA interaction looks additionally. All right, next slide. The technology that I described and the philosophy behind microtransit is used to solve a variety of transit use cases. David, I know you highlighted a number of them, but some of the more popular ones that have come up, especially during COVID times, is one, acting as a first mile, last mile transportation option. So how are we able to aggregate more riders who are asking for transit coverage, but we can't really affordably provide with fixed route, and then bring them to some of these bus stops or these light rail stations so that they can ride the regional transit service. We also operate in transit deserts. So anywhere where there are, especially if there's like Amazon warehouses, hospitals, any places that people need to go to and they're just not affordable and efficient transit options, we can cover those areas. And then we can replace underperforming fixed routes. I talked about that in Hall County, where you as transit agencies, you understand which routes are working well and which ones aren't. There are great cases to continue using fixed routes, especially where there's high ridership and very predictable travel patterns. But for those routes where those may not be the case, it might be an opportunity to explore how microtransit could serve you better. I don't want to go into all of these use cases. I like to think of this as a menu. So pick and choose the thing that works best for your palate. But one of the benefits is really being able to operate all of these in one platform. So rather than having your riders jump between multiple applications to choose different transit options, or your dispatchers only being able to provide one service depending on what they're trained on, it's one platform that everyone can use to book their trips, pay for their trips, understand where their vehicles are, and then be able to manage the fleet, do dispatching, scheduling, everything that you need in one platform. Next slide. Before we start going into some of the case studies and examples of how we've worked with other agencies, I do want to say that VIA traditionally works with transit agencies, cities, counties, even some private companies in one of two ways. The first one is our software as a service model. This is where you guys provide your own vehicles, your own drivers, and then we have the technology to operate them in a more demand responsive fashion. So keep what you have, just operate it in a little bit more nimble and flexible way. The second one we call our transportation as a service option. This is where we not only provide the software, but we can actually provide the vehicles, the drivers, we do fleet maintenance, insurance, fuel. It's a full turnkey transit solution where we act as an extension of your agency and then collaborate with you in order to ensure that we're serving the community as best as we can. All right, next slide. All right, so David, thank you for eliminating column number 1. So that gives me a little bit more time to focus on the other 2. So if you guys have any questions about Salem, I'm absolutely happy to answer them, but David is definitely the better resource to go to. I want to quickly talk about 2 other partnerships that we have in Massachusetts. The first one is in Worcester, 25 square mile zone. You guys can read the statistics there. I think the thing that's really unique about VIA is we try to solve the unique transit circumstance that applies to every community. For Worcester, they had a lot of people who were commuting in and out from the MBTA, but there was a really big need to provide more flexible coverage within the city itself, specifically in Westboro. So this is where we went with the transportation as a service option, where we're providing also the vehicles and the drivers that covered a large area within Westboro, not only enabling those trips that connect to and from MBTA, but also within the city itself. Based on a lot of the data that we collected on how it was improving the quality of life for the community, how it was helping them get to and from these critical appointments that they had to make, we actually made the case for expanding the service. And now it includes Shrewsbury. And that's one of the things that we try to work with our partners on are what is the really intelligent way to grow? How do we change and modify our service? How do we keep on tweaking the parameters until we get it right? Especially if we know that there's an unmet transit demand. I think that's one of the benefits rather than having to have months and months of committee meetings to assign new fixed routes and trying to guess on how you're going to get it right. These areas are covered and now you can enable transit to them. The last one is Cape Ann. This is one where we're providing just the software and they have the vehicles, but the main use case was providing transportation to people in industrial parks, in warehouses, to any areas where they really wanted to get to places of employment, but didn't have reliable transit services. And so we did a lot of collaborations with economic development groups and other large employers in the area to set up a service zone that really provides that flexibility to employees. Next slide. This last one I'll just very quickly talk about for the sake of time. This is in Green Mountain Transit in Montpelier, and I think we have some people in Vermont here as well, so I wanted to touch on this. They had a couple of underperforming fixed routes that they wanted to find a better solution to provide community level transit, as well as to help people get to medical appointments. So not only did we replace these fixed routes with an on-demand microtransit service, we allow them to pre-book their ride so that they have the confidence that the vehicles will be there, especially during times of surging demand. And we've worked with some of the local hospitals in order to enable them to book rides for their patients so that they have a reliable way to get to and from these appointments. All right, I think there might be one more slide in here. And so, there's lots of ways we can use on-demand transit to solve some of your community's most critical needs. We can provide references if you guys are interested in talking to any of our partners. We could have a planning and consulting team. We can do demos of our technology, simulations to understand and get a feel for how this might look customized to your community. And then if you guys are going through procurement, especially through RFPs, we would generally love to respond and see if there's opportunity to work together. So yep, that is my time. Thank you all very much for listening, and we'll be happy to answer questions when that time comes later on.
Great. Thanks, Terrence. Definitely good to hear about some of the more rural applications, especially up in Vermont. So I am going to stop sharing my screen. And let's see, Angela, are you able to get yours up? Great. All right, take it away.
Yep, can everyone see it? Okay.
Yep.
So like Julia said, so I work for GATRA in Southeastern Massachusetts. We have four very, very distinct, for one area, they're very different. So I wanted to first tell you a little bit about GATRA, and then I'm going to talk about our four different services and the characteristics of them. So we cover 29 communities in Southeastern Massachusetts, from Rhode Island to the water. We have a mix of services in our area. We do fixed routes. We have obviously the microtransit. We do complimentary paratransit, dial-a-ride, and then local and long distance medical transportation. So this is my handy dandy cloud slide that I wasn't going to put, but I thought it was fun. So these are some of the reasons why we chose microtransit. We like that it increases access to transit. It expands transit to underserved regions. Absolutely, in our area, improves access to employment, provides kind of a cost-effective, safer, and accessible option to Uber and Lyft. I'll talk about it a little bit later, but we are using all accessible vans for our service, and that was a huge issue in our area. It replaces underperforming fixed routes, and then also, which is a huge issue in our area, is provides those first and last mile connections. And I think everybody kind of touched on that too. So we named our service. So we have like an overarching, all of GATRA microtransit service. We call it GATRA Go. And then each one of our four services, we add a, kitschy little name to the end. So we have like GATRA Go United, GATRA Go Connect. So that's kind of our service model. So we are currently, we started with two pilots. We chose two separate software providers to kind of see which one we like better, what kind of services we're going to work in our area, or which parts of the app we're going to work best in our area, I think is the best way to do it. So right now we have two apps, Transloc and Spare. And then we're doing $2 a trip for everyone. And we are using what in their previous life was dial-a-ride vehicles. So smaller, accessible vans to run the services. And we describe the service as an on-demand, same-day, safe and accessible public transit service, providing curb-to-curb service open to everyone for any purpose, provide service in an area where affordable transportation is a lifeline, which I know everybody understands. But in our area, we're kind of a mix of urban and suburban. And although our fixed routes worked really well in the urban areas, we were struggling with fixed route and dial-a-ride being our only service options for some of our suburban areas. It just wasn't working. And a few times kind of towards right before we kind of put the microtransit into play, we did like plan a few fixed routes where like during the planning process, I'm like, I know they need service, they want service, this is what we have to offer them. But as we're planning it, I'm like, this is ridiculous. Like this town, a fixed route in this town is not the best option. So when kind of microtransit came around and the option to do some pilots to figure out if it was working in our area, we kind of identified those exact routes to be like, no, we have to cancel this and try something else. So our very first microtransit service in the towns of Foxborough and Mansfield, we recently added Norton to that list. So prior to GATRA Go, the service area had a fixed route connecting a community that has a college, rather a large college in it, to a commuter rail station. And it ran all day, so it kind of served commuters in the morning and the afternoon, and midday it brought students to grocery stores and to the commuter station to go into Boston and that kind of thing. We also had a commuter shuttle in that area and dial-a-ride service for seniors and persons with disabilities. So this was our first one. It started in August 2019. Norton was recently added. So we're running it Monday through Friday, 6:30 a.m. to 8, and then Saturday and Sunday we do 12 to 8. And in this, for anyone not familiar with the area, in this service area is Gillette Stadium in Foxborough, which is great for many things, for shopping and watching games and lots of great things. But when the state police shuts down all the roads connecting to it 6 hours before a game, again, it's a little bit of a transportation conundrum. So that's absolutely one of our issues that we were dealing with, that we're currently dealing with. But as far as the service goes, we do have the app, or you can call through dispatch. You can do either or, and we were running it with 2 vehicles, and we added 1 in November. So just a few of the challenges. I talked about Gillette Stadium, but a few of the challenges, because 2 of our microtransit services touch each other in Foxborough, like they come from east and west to meet in the middle at Gillette Stadium. So Foxborough has 2 microtransit services they have access to, and they're 2 different apps. So that's kind of where the 2 services connect. So that's provided some confusion. So that's one of our issues. I think we're kind of working towards a service model that will make a little bit more sense and be a little bit more cohesive. And we're going to go out for RFP and do the whole thing. So we're going to hopefully just have 1 app to cover the service area, but that is currently an issue. Also dealing with campus, college campus stops, defining stops, and not having them book a trip directly from a dorm is a huge issue. And then the college paying for students to ride, and kind of dealing with that with the app, and, you know, categorizing them as, you know, free and all that. That was a kind of an issue. So in terms of ridership, in 2020, we did 8,800 rides. And then 2021, 14,631. So that larger college I talked about is in Norton. So that was just added in November, and we're seeing a lot of ridership. So that number is going to go up. This is just a quick look at our service area. You can see Foxborough there, Mansfield kind of in the middle, and Norton. And then that pink line is a commuter service that connects 2 of our bigger cities that goes through. This is our geofence for that service area. The second one we added is one in Plymouth, specifically in South Plymouth. So the issue with this one is Plymouth is gigantic, and we had sparse dial-a-ride service in the South area, only a few days a week. And then we also tried to supplement it with a deviated route that would run, kind of run parallel to each other. So we removed the deviation from the fixed route, the deviation portion, and then converted the dial-a-ride section to GATRA Go, so that anyone can use it. So one of the issues with this is that making the connections to fixed route on this, just because the service area is so large, is hard. So getting people all the way to where they need to go without another service is difficult. But people are really using it in this area, because there wasn't a lot of transportation in South Plymouth, just because of the geography of it. So this is just South Plymouth to downtown is the top. That's half of Plymouth. So this is the service area for that section. And then in December 2015, so it's December 15th, 2020. So what happened in these towns, these 4 towns, we had a couple fixed routes, 2 fixed routes, and a regional dial-a-ride service. And we had shut the fixed routes down due to COVID, and they had not come back yet. And they were not doing the best before COVID. So we decided, instead of bringing them back like they were, we're going to bring them back as a microtransit. So this happened in December of 2020. We took what was all the fixed routes, the dial-a-ride service, and a long distance medical service that ran in the area, and we made it into one GATRA Go service. This one has been wildly popular and has been a huge hit. People are really using it. So this one runs kind of to the east of Foxborough, and it includes a college and a couple communities that had heavy ridership on their dial-a-ride. One of the issues with this one that we're struggling with is just, convincing people, since we're using the same vehicles, convincing people that it's open to everybody is one of our issues on this one. That, just because it's the same vehicle, we wrap the vehicles in an effort to make it more distinctive. But that's one of our issues here, is that it seems to be in certain communities, it's still just people who used to ride the dial-a-ride and not anyone else understanding that it's been expanded. So that's something that we're struggling with. And because we started it in COVID, outreach efforts were hard to deal with. So And again, this is an app. This is our spare. So all the other three use Transloc, and this one was a pilot for the spare technology. So this is the one that has the separate app, and we run. So the long distance medical is specifically for seniors and persons with disabilities, but we use a shared fleet. So you have to call in to book those trips and the dispatch will put it in, but it uses the same system so that the vehicles, like if there's nobody using the long distance medical that day, those vehicles are automatically kept within the GATRA Go local service, so that instead of like designating, well, this just one vehicle is going to be our long distance medical vehicle, we kept them all together in order to kind of tag team those vehicles. So they use a shared fleet. Again, a couple of the issues was that Foxborough is on both. And then this one has a lot of weird things where the senior center wanted to pay for their people and the town wants to pay for their people, and college students, or the college is paying for their people. So trying to kind of deal with all of those issues. We had to institute like people putting their zip codes in, which is something that they had never dealt with before, but we were like, we need to know what town they're coming from, because when they register, they don't have to put addresses in. So, I mean, I think we think about, oh, we'll just put your address and that's fine, but their home address is not part of the registration process. So that was a hurdle. But we figured it out. So actually, it's so funny. This is our anniversary too. It's the 16th. So we started the 15th. So 1 year ridership is 21,837 we did in a year, and this is our anniversary. And this is that service area. And then I'm just going to quickly run through this one. I know I'm up for time. So this microtransit area is just one town, Pembroke. It's a very small town on the South Shore. We had a commuter service in this town, and we stopped it and we did some surveys to bring it back, and the commuter, there was no demand. So we decided, for the few people who still needed it, in addition to expanding it to some of the other people in the community, we started the commuter service back as a microtransit service. So the same one vehicle that was running commuter service we're using for this. It only runs during the week, but we are running it. One of the issues with this is that it's just the town, but a lot of the destinations that people need to go to are not in the town. So we have the town set up as the geofence, but the neighboring town has the Social Security office, the mall, the grocery store, whatever. So we had to do, the town of Pembroke serves as like the main service area. And then we added those points so that there's specific stops outside that they can go to. So in the beginning, it was very much like we put what we thought they needed, and then we had to add as we went on. We had to go in and add, okay, well, oh, we forgot this one location has to need a specific address. So we did a little bit of that. And since March, this one started in March 2021, we've done 1,400 rides. So it's a pretty small town, but yeah, this one, we're trying to get the neighboring town to sign on, the one with all the locations, but they want to keep their data ride service really bad. So we'll see how this one plays out, but those are our microtransit services. I think that's the end. Yeah.
Great. Thank you so much, Angela. And thank you to all of our speakers. We have about 12 minutes left, and we have some questions in the chat already. So I'm going to go ahead and get started with those. And as I'm asking the questions and folks are responding, if you have other questions that you want to raise your hand, we can call on you to ask it directly as well. So let's start. Let's see, the first question from Larry was about the demographic profile of riders. And I know, David, you were able to touch on that a little bit, but wonder, Terrence or Angela, anything else you'd like to add to sort of how you're hearing about or learning about demographic profile of riders?
Well, I think one of the great things about microtransit, across a variety of providers, is actually having that data. So it's not only understanding who's riding, where are they going to, what times are they going to, what times of day, and you can really put together some very sophisticated analysis to get a better understanding of who's your demographic, who do you need to start targeting, and then really dive into that. And so I think that's one of the benefits compared to, we've got a bus, we know that there are some riders, and that's about all we can figure out.
Great. And then the next question, Terrence, is for you again. Does VIA's app include multimodal walk, bike, bike share, fixed route, or transit, et cetera, for trip planning?
Yeah, absolutely. The short version is for anything that moves, we can find a way to integrate into it. We have a service that's in High Valley Transit in Utah. Right now, we're powering their microtransit, fixed route, and paratransit services, which can all be booked via an app. We also have another one in Miami-Dade called Go Connect. In that one, you can look at a microtransit proposal for your trip, but also see what the nearest fixed route that'll accomplish that same trip is. And so different agencies have different ideas behind it. Some of them want to understand mode choices. Some of them want to encourage mode shift and encourage people to use different lower cost, more efficient transit options, but we can accommodate all of those.
Great. And I see two questions on here around sort of funding. So I'm going to ask both of them and hope that the speakers can try to speak to both at once, just so we're covering as much as we can. So the first question, for these services, how much funding is coming from city tax revenue? And then there was a second question from a different person asking about the fare recovery percentage for microtransit. So I think David and Angela, let's get started with you both answering that. And then Terrence, if you have any other examples you want to throw in from VIA's end, please do.
So currently, as I noted, zero tax revenues coming to fund the service. It's we started with a grant from MassDOT with their workforce transit grant, and the others were really coming through private development, as well as the marijuana dispensaries. The city, when we were bringing these types of facilities in, negotiated that 1% of all gross sales over a 5-year period from when they received their certificate of occupancy would go towards this transportation enhancement fund. So for the first year, and now we're in the second, again, there's been zero tax dollars into it. The fares themselves, they do go to the operator. Right now, we are working, like I mentioned, the pilot with the hospital, where a portion of the fare will come back as a credit for the city to help with it. So again, it's just a partnership where we're trying to work with stakeholders to capture some of the true costs of providing the service.
For us, as far as, so GATRA communities the community pays 50% off cherry sheet, 50% of services from their cherry sheet, 50% comes from supplemented by GATRA from state and federal services. So in all of the towns I talked about, the microtransit service replaced any service that we had in their community. So this counts as like their transportation service for the community. So we're using that local state federal fund split in the same way. It's just a different service model. And as far as recovery ratio, I don't have the exact ratio, but I would say it's probably not very good. Those trips are, on-demand trips they're pretty expensive. And we're only doing $2 a trip. So I would guess it's not good, but I can get you an exact number.
Awesome. Anything else, Terrence, on your end that you want to add to that?
We can go on to some of the other questions. There's a variety of
There's lots coming in. All right. Next question. This is, did anyone have a direct route service that they canceled to replace with something like these services? And I know, Angela, you've just talked that through. I think that question came in before you were done with your presentation. But if there's anything else, David, I know you guys were looking at fixed route service and sort of leaned toward microtransit. Anything you guys else want to add to that? Feel free, otherwise we can keep moving.
No, we did. That was just an option we were looking at, but we thought having just the on-demand rideshare was the way to go. And we did even look at, we have a council on aging vans that we explored, looking at the software as a service option that VIA provided, but we saw this as not just for seniors, but for everyone in the community. So it's a supplement for seniors who have that option to either use the council on aging van or the skipper service.
Great.
I'll just throw in one more thing as well. Looking at it actually in the opposite direction as well. We have a number of partners who are operating microtransit services to understand where they should put fixed routes. And that's a really great way of taking the actual demand, the times that people are traveling, rather than doing surveys or kind of guessing with consultants. You actually have that real demand data, and you can determine, can we more affordably serve this microtransit trip with a fixed route, and then use that as a way for doing planning.
Great. Thanks, Terrence. Really good point. Next question is for you, Angela, asking about if you could share your experience with SPARE versus Transloc, and what has one worked out better than the other and why?
Yep. I'm a control freak. I should start with, just start with that. So I really love, being able to twiddle with all of the different aspects and every single part of the back end of the software, and being able to really customize it on the back end. And I can say from our experience that SPARE has been much more able to respond to some of the weird requests that I talked about, some of the very, we need between these hours, we need certain people to be free, and we need this geofence to be cut out of another geofence. So some of those, requests, I found SPARE to be more responsive and Transloc to be more very useful for maybe a small area that doesn't have as many customizations that are needed. But if things start getting tricky and you need more, I found Transloc to be less flexible. Great.
Thank you. And then I think we just have one last question in the chat, which I will throw to you, Terrence. And this is about appreciate the rural and small town examples. Is there any specific advice or queries you would have for a rural community with only a traditional dial-a-ride that's considering microtransit as an alternate option? So advice for rural communities.
Absolutely. I work with a lot of rural communities who ask that very same question. And it all really comes down to intentional and data-driven service design. The way that we look at it with VIA is that you're trying to balance three different parts of an equation. You're trying to balance the demand for transit. You're trying to balance the supply of vehicles or funding that you have available. And you're trying to balance the quality of service, whether that's on demand, pre-scheduled, all sorts of variety of variables that come into that. What I will say is, if you have a fixed supply of vehicles, we can definitely go through some exercises to help figure that out. But we've worked with some really interesting communities who have found unique ways to do more with less. As an example, we have a service in Baldwin County, Alabama. This is 2,000 square miles, just a massive area. And what we decided to do with them is actually create certain zones in very urban, dense areas where we're doing on-demand trips, and it has the ridership and the volume to support that. But then for the outskirts and the rural areas, we're doing those pre-booked, pre-scheduled services. And the great thing is that they're using the same fleet to better respond to demand. They're just mandating different requirements depending on where you live. And so a lot of times, even if you do have a lower density area that's widely spread out, even if it doesn't make sense to do on-demand, providing things like app-based booking or really smart aggregation and lowering those trip distances can still make a world of a difference to people. And then for those higher density areas, maybe looking at on-demand makes more sense.
Great, thank you. We have 2 more minutes. If anyone has a last question they want to throw out, you could just jump right in.
I was just wondering, this is Bridger McGaw. I have sort of 2 hats. One, I'm run commuting for a company, and 2, I'm the president of the TMA. So I'm trying to figure out and advise people on sustainability of the program, because part of the challenge is like making them make the change. Like they're so angst ridden about making the change because they don't, like we've all been saying, you don't know the data, and they want to be data driven, but they won't go get the data. So then they won't make the change. And so it becomes this like really awkward moment where you're like literally want to wrestle the whole thing to the ground and just say, I'm going to sign the contract for you now. And then it's too late. So, but the tax thing bothers me. Like, I think towns should put money on the table, not grants. And so I'm trying to figure out how culture changes. All of us are advocates for sustainable transportation change. And I was just wondering if someone could advise me on like, how do I get them to see that like, it's okay to start with like 2 years of guaranteed funding to allow the engine to sort of like feel better about paying into the system because the developers aren't getting you all the way. I don't know how to help defeat their arguments other than wrestling.
Terrence, I know not to throw this back on you, but you have probably just the broadest look here. If you have any good examples of longer term non-grant funding coming from cities, it would be great to hear about it.
Yeah, I think one of the best things that we found is also finding other community partners to work with in this space. There are ways that you can actually work with the businesses, especially those struggling to find transportation options for their community, with hospitals, making sure that they're in the coverage zones, but there are ways that they can pay into the system in order to help subsidize some of these trips. There's also in-vehicle advertising. And that's a really great way of looking at opportunities to provide, but still control the content by the city or the county, having in-vehicle screens, wraps, et cetera. We have partners that are actually offsetting half of the cost of running the new software program just by doing advertising. And so those are ways of bringing revenue in the equation, as well as trying to create efficiencies with the transit operation. So just a couple things that can be considered.
So I want somebody to pay for it. I want the taxpayers to pay for it. So I think there's skin in the game arguments. I think it's really hard for us to push it all on the business, the administrative burden of the members, as opposed to like the grant, by the way, state, local, federal, that's everybody on this phone calls taxes, went to fund something. So I'm just trying to argue, like, how can ACT sort of surface that change management equation, which is like, guys, microtransit is like a 20 grand. It's 100 grand. If you did 100 grand for 2 years, it actually
productive morning.
creates the change management.
I wonder.
Today, you haven't been excited already, or have you?
Thanks so much.
I mean, like that guy, like he's
Unmute.
excited. He just like wants in.
Yeah, Bridger, I'll mention, I think one thing that we often see a little bit more successful, and I don't have a great like microtransit specific example, but thinking about tax districts or specific plan areas, or when you can sort of pinpoint a specific area where the taxpayers are paying for this service that they're directly getting, that often is a bit more politically easy to move through than a whole citywide tax going to a service that may be paying for just a portion of coverage across the city. So that's something I'll throw out there.
I know we're at time. I just wanted, like, we have the Lex connector in my town. Lex, we run a fixed route system. We're taxpayer, they're empty buses all day long. Then Watertown has only private sector entities running our buses. And so I'm watching these two things and I'm like, oh my gosh, they both need like part of it, but both communities, one's not paying any taxes, the one's all taxpayer funded. And so there's got to be something in here, guys, where like I think we could help everyone by understanding grants don't get you sustainable 10 years of emissions reduction. That's the like thing I'm hung up on, is I want a 10-year program of via plus shuttles, making culture change. I don't need to buy a car.
Yep, I think that's a really good point.
Stuck.
And Bridger, we can chat offline. Let's think about an ACT international conference panel where we can bring in some folks who have done that.
Great, now I just got to sign work.
I want to thank everybody for joining today. Really, really appreciate the presenters. Thank you so much for your time. And David, Terrence, and Angela, are you okay with us sharing contact information on the website in case folks have questions? Because I think we didn't get to everything here, and I know people want to hear from you.
Absolutely. Yeah, and I want to talk to Bridger about TMAs and using public funds and sharing. I would like to talk about that, so we can talk offline.
Bring it on.
Well, you can talk to the TMA council at ACT too. We can connect you with lots of people.
Put it on Connect.
There we
All
go.
my shout outs at one place. All right. Thank you so much, everybody. Really appreciate your time, and we'll see you soon. Take care.
Thanks, Julia.
Thank you. Happy holidays.
Thanks, everybody.
This was excellent. Thank you. Excellent.
Happy holidays.